Now, the second session is on study variables and data documentation sheet, study tools, validation of study tools, data management by Dr. Imran Pasha M. Reader, Department of Public Health Dentistry. He is also a member of CAOP, coordinator of Yen-DEU. The moderator for today, for the second session, is Dr. Vijay Kumar, additional professor, Department of Periodontics and Implantology. He is also a member of Yen-DEU. So let's start our second section by Dr. Imran Pasha M. Over to you, sir.
Thank you, Shakira, for that wonderful introduction what you have given. And onto the session, I request all the participants use the link, click the link, and join for the session in the Friday, because I have put up some interactive session for all of you, so that to know how many of you are listening to the class. And I try to make it as simple as possible. The topic is on designing the data collection tools. So basically, I'll be describing the way how can you design a data collection tool for your study. So I think around people have joined using the link. I have put in the chat box. You just have to click the link. It will take you to the joining page. So before starting the session, I just want to have a brief idea into what do you think about the topic. I think you can use your mobile phones and you can type in your responses. What do you wonder about today's topic? I just want to have a brief idea on what do you think about the topic. Is it important for you to know how to design the data collection tools? Is it important for your research? It's very easy. I think the platform, I've been using this PEDEC platform for my students. Okay, I can see the first response coming in. Good. Okay, yeah, that is the easiest way of answering, isn't it? I expected all of you to answer yes, sir, and a no, sir. Good. Studying about the research question and studying about how to design a tool is a very important part. So now I have to learn how do I frame a question, a proper question, so that I can elicit a proper response. Now you can see, when I asked a question, everybody has easily answered yes, sir, yes, sir, yes, sir. Okay. Yeah, it's interesting. Definitely, yes. If research is the field of your area of research, definitely this becomes interesting. I'll move on because 25 people have joined in, and I have got few responses. I'm very happy that you are able to adopt to this platform. Okay, so let us move on. On what does it depend on? How do we design this data collection tool? Let me remind you, let me give you a brief example here. You can see here, this is one of the data collection tools I had designed for initial study of mine. You can see as an annexure. You can see it was my study on experiences of stigma among people living with HIV and AIDS in Bangalore study. This is the data collection tool I had designed. Basically, it was a questionnaire study, and it was a type of a schedule interview I had prepared. You can see as a PG, you are very much interested. I had around 40 questions for my first short term. Yeah, yes. That is basically a data collection tool for you. Now, what does it depend on? Already, previous speaker has given an excellent class on various types of variables, and he has introduced into variable terms. Do not get frightened, or do not get worried about all those terminologies. You have 3 years to understand all these terminologies. As and when you read more and more literature, as and when you do more and more research, you will understand this terminology. We are not expecting all of you to understand everything what we are telling today at the go. No, we are not. So we are trying to introduce the terminology so that you are better prepared when you're preparing your dissertation topic. So data collection tool, preparing the proforma is one of the important activities. Your entire study depends on how well you design your data collection tool. It depends on what type of a variable are you collecting. Are you collecting a quantitative variable? So quantitative variables you can collect by just by observing, interviewing, rating scales, and by questionnaire. Now we have a qualitative data which can be collected in terms of in-depth interviews, online forums, COVID has changed a lot. We've been pushing people to come on online platform for qualitative data, but it was difficult. But COVID has changed the entire situation, upside down. Online forums have taken a huge role. You should know that, a lot of terminologies have come across. I even read about the webinocarcinomas. That was good. You'll feeling happy about it. Yeah, groups, web survey charts, online communities. Now, I have restricted myself for the, because we have a shortage of time, to questionnaire, how to develop a questionnaire, how to design this tool. I have restricted onto that part of the talk today. So what are you going to collect by using the questionnaire or quantitative information? Basically, we are going to collect three important parameters. One is the fact, the knowledge, and the judgment. Facts in terms of the individual characteristics, definitely you want to correlate age, maybe height or clinical history of theirs to the parameter of interest. It might be how age defines the heart diseases, you would want to correlate. So individual characteristics you would like to collect. The environmental factors, how housing or how family size, may be a factor in deciding the disease. Even the behavioral practices, very important in the field of dentistry. Alcohol use, drug prescriptions, in terms of caries, it can be sugar consumption. I can go on and on and on for behavioral practices. Even the oral hygiene practices, we normally deduce that poor oral hygiene leads to more poor oral health. One simplest of the examples for all of you, how facts can be able. So we are going to design our tool keeping all these things into consideration. The second point is the knowledge about the risk factors. The risk factors can be diet, can be chewing of the tobacco, how it can cause, chewing tobacco can cause cancer, and diet, how it can cause caries. So basically you would devise your pro forma based on all these risk factors. Healthy lifestyles, again, diet and exercise, how it can improve or how it can deteriorate the health. It can also be studied. In terms of exercise, we are coming to it can be a double-edged sword, I can say. Exercise, if you do too much of exercise, does it lead to heart attacks? This is a new research question I am putting. I'm not telling now everybody thinks that exercise will lead to improved quality of life. I'm just turning the tables down and putting a research question. You just have to design the pro forma, how he is doing the exercise. Is it leading to cardiac problems? It's just that. It's the knowledge. We are just trying to do the research. I'm not telling that exercise doing is bad. No, but we are trying to collect the information on the other way around as well. Judgments, the opinions on quality of health services, like how well Enapaya Medical College or Enapaya Dental College is delivering the oral health care services. So we will devise the questionnaire based on the opinion. So we want to collect the opinion of the patient. We want to go collect the opinion of the various stakeholders, like the faculty, the students, and everybody else. So based on that, we can design our data collection tools. The judgments, the attitude, and a very important point: pit and fish of sealant and a topical fluoride application. Does attitude, if they have a poor attitude, that doesn't mean that that means that they are not going to practice this in the clinical area. So you're going to devise your questionnaire based on these three important factors, like whether I'm going to collect the fact, whether I'm going to collect the knowledge part, whether I'm going to collect the judgment part. So you're going to devise your questionnaire based on whether it's a knowledge, whether it's a fact, knowledge, or a judgment. So coming to the next point, different tools to collect the data. What are the various tools what we have? One of the important forms is the abstraction form. It's basically, you are collecting a lot of, case history forms. So we can go back and review all these records. It can be a personal record, it can be clinical record, it can be surveillance record by various government agencies, and the registers, like you can see the Government of India keeps the all the vital statistics, like death. From the death report also you can collect a lot of information. So basically you will just design one abstraction form and you will go and collect the data from that place. Structured observation guide. Now there are a lot of checklists which can be done used for this. Now a simplest example is, if you want to do how well the patient is following the infection control in the clinic. So what will we do? You will create one simple checklist. He washes his hand before every patient. You will just stand and observe, and you will just tick it before the student is going ahead and taking up the patient, whether he is wearing the gloves aseptically or not. Simplest tick checklist form you will create, and you will tick, and later at the end of the day you will appraise the student on this observation what you have made. So that is structured observation guide for you. Questionnaire, most commonly used, most abused tool you can say, but one of the simplest form to collect the data. Questionnaire, on any part of the research you want to do, questionnaire becomes the easiest. And with the technology, with the use of the technology, it's all the more easier in the form of a questionnaire to collect the data. There are various ways you can administer. Either it can be face to face in the form of an interview, you can call up in the form of a telephone, or computer assisted in the form of an email. It can be self administered, paper based, or computer assisted. You can get the link and you can go and meet the person one by one, and you can administer it to them, so that your response becomes more easier. So these are the basic ways of collecting the data. So you can see here, uh, there is some problem here. So I had different tools. This is one form of a checklist. I think the animation is not working because of the bad deck, but it's fine. Okay, this is an example of a checklist. You can see here about they are assessing about the program evaluation in terms of awareness planning. They just have to tick. The person who's collecting the data had just have to observe and tick it. This is one form of the abstract, the checklist forms. So what are the key elements when you're planning a questionnaire for data collection tool you have to check, you have to take care? One is, it is simple. In English, it is clarity, the words. It has to be very simple. If I have to say, it should be made sure that your questions are readable at the standard 4. That is the simplest I can put it. Balance. Do not use and or words. Do not combine two questions. Balance it. Ask only single questions. Length. Do not have a long, lengthy questions. Mind you, all these things will depend on your aim and objective of the study. But I'm trying to tell you, keep the length of the question very simple, very small. Okay, comprehensive. The responses should be able to cover what you're trying to ask the questions. Utility. The instructions to the person who's recording should be very clear. All the constraints about the response should be explained. The order of the question also makes very important. Do not ask personal questions at the beginning, or it might become very embarrassing, and it leads to non-response. So the order of the question also makes a lot of difference. The context with which you ask these questions also very important. So what are the components of a data collection tool? I told you that I'll be talking on questionnaire. What are the components which you have to keep in mind? One is the introduction. You have to introduce the topic to the people very well, and it should contain your objective of the study, elements of the informed consent, the concluding the concluding statements can be included at the first bottom. The identifiers, like collection of the name, addresses, you can code it from the point of view of the ethical point of view. The body of the instrument is where you will have all your questions. So it can be an open-ended question, it can be a closed-ended question, or it can be a semi-open-ended question. Do not worry, what are these? I will tell to you in the next few slides. Instructions for the data collectors should always be there. In case if you are having data collectors for you, you should always instruct them how do you collect this data. So basically it can be in terms of the instructions already in the pro forma. You should explain to them the skip patterns as well. Like when you formulate a question, if the answer is no to one question, you should directly go to the question number 10. That all these things should be explained prior to the data collectors. You can always use the different fonts to differentiate between these two things. So these are the few guides when you're various components. I think okay, I had an example, so I had prepared for this. I think let me go as a PPT for you, all of you. Give me a second. Okay. Okay, this was the checklist before previously. This is the data abstraction form. You can see that nicely designed. This is the example of a sample observation guide for a field day. This is the example for the program evaluation sheet. So I'll skip this and come to, yeah. This is the form which I had designed for my study. You can see here it was a study on faculty postgraduate. You can see the study participants information sheet I have given. I have given the background of the study in the form of a Google form. This was taken in the Google form. You can see whom they have to contact. I have given them the consent form as well. You can see the participation consent form. Then I have collected all the identifiers. In my study, I just had to, it was an anonymous study. I just had to collect their gender, years of teaching experience, designation, and the type of responder as well. So, and then this is the main body, which is the questions. So let me toggle to my presentation. Yes. So coming to the what are the different types of questionnaire? I'm not going into detail. It can be unstructured, it can be closed-ended, it can be semi-structured. Basically, these are all the types of what types of a question you include in your questionnaire. You can combine all these three forms. You can actually mix and match as well, so that your study becomes very important. Again, further, let me tell you that it depends on your aim and objective of your study, what type of a questionnaire or what type of a study tool I design. So I'm giving you a brief introduction into all these types. So what are the steps in questionnaire designing? You can see a QR code. You can scan the QR code. You will get a article by the Association of Medical Education of Europe. It has given a very nicely written article on how to review how you can form the questionnaire, because this is out of time. Basically, you have to do the literature review, as Dr. Ismail sir has told. Before sample size collection, you have to do the literature review. Before designing any questionnaire, you have to do the literature review. Without that, you will not be able to do anything. So basically, you will gain an understanding about the topic. You will know what questions to be asked, what options to be given. So you can consequently, you can always, after forming the literature review and after forming the questions, you can always conduct an interview with the people, select group of people on whom you're going to administer these questions, to find out what is their opinion, what is their point about this questionnaire. So combine both 1 and 2. In the third step, you can synthesize your questionnaire, because it becomes much more effective. So the items have to be developed in a step 4. In step 5, you can always, after doing this, you can go and give to an expert who can be head of the department, who can be a professor, who can be a reader, or even it can be an assistant professor in the department. There is nothing wrong in taking opinions, because what happens is your questionnaire becomes that much good. So basically, you can go for an expert for a validation. The second step is sixth one, cognitive interview to be conducted. I will skip here. There are a lot of techniques. Think aloud technique is one of the important texts, because basically you have to read out aloud and think about how well they are able to understand the questions. Then the last step would be, most important step is to conduct the pilot test. Why the pilot test is important? You design a questionnaire. What happens is you will think that, oh, this is the best. I have designed so many questionnaire. I always think that's the best thing I have done, only to come to know after the pilot testing that I have to do a lot of changes. There are so many problems with that questionnaire. So this can happen with anybody. So pilot testing you have to do. There is nothing wrong. You have to go back to the drawing board after doing all these things. It is better, rather than collecting, after all the information you collect, you come to know that this questionnaire is not doing what it's supposed to do. Okay, so I hope you have already got the article. You can go through the article to gain more information on that. So let me come to the main part. What are these open-ended questions? What did I talk about this? What did I talk about this open-ended question? Now we have, all of you have already filled the feedback form. I'm very happy that few of them have typed in answers for the question 6. I did not expect people to type in the somehow I am aversive to qualitative type of research. I always think that people will not type in, people will not do it. I would rather do a focus group discussion than give a questionnaire in terms of an open-ended question. But that's I have the fear as a researcher, but I think it will go as and when I do more and more about qualitative research. So basically, it's just a question. Any other observation about the presentation what we have done? Few of them have written very well presentation, good presentation. So that's all. It's just an open-ended question. So answers I have not suggested for you. You can give any type of a response. So basic advantage of open-ended questions are, it gives the freedom for the person who's responding. Sometimes if I think about theory, it stimulates memory, and definitely it can be used to generate closed responses at a later point in time. Basically, it helps in hypothesis raising. The disadvantage is definitely when you sit and analyze, you have to go through all the answers what they have. You have to code. So that definitely is difficult. We have one more variety in open-ended with closed-ended answers. If if you want to get, do not want to get vague answers from the people, still you can give an open-ended questions by, you can see an example here. What are the practices may increase your risk to dental caries? In between snacking, I have given them the answer of yes or no. Poor oral hygiene, I have given them the answer of yes or no. Poor dietary practices, yes or no. Eating too much sugar, yes or no. So I have given, may not be a good question, but still I have given them the options. I know what answers they're going to give. Either they're going to answer yes or a no. So, it becomes an open-ended questions with closed-ended answers. So it was not like a previous where, they can write whatever they want. But here I want them to be very precise when they are answering. That is the choice. That is the way you can design your questionnaire. So it becomes easier for you to analyze, as well as the entire objective of this question or this questionnaire is to know how well people know about food or diet about causing diet causing caries. The next part of the question is closed-ended question. When you design a questionnaire, you can do a lot of closed-ended questionnaire. What does it do? It gives only options for them. Okay. With a dichotomous option, closed-ended are my favorite questionnaire type of design, because I already know what responses I want from my, because of the review of literature, what I do, I already know what responses I want from my respondents. So then you have to go for a closed-ended questions. So you already give them this question. Now you can see the sample question there. Tobacco causes ill effects on health. That is the question I have given. So I know that, my point is tobacco causing ill health. So I have given them the answer of yes or no. So my respondent is supposed to answer either by yes or a no. So I will get a qualitative information. If I would have given an open-ended question, tobacco causes ill effects on health, people who consume tobacco, they would have told you are lying to me. People who are against tobacco, they are telling you are a biased person. So they can write whatever they want. So does it help for my research? No, it does not help for my research. So this is the advantage of giving a closed-ended question, and that too a dichotomous option. Sometimes it might oversimplify your research question. That's a plus and minus we have to take as a researcher. But it's one of the important closed-ended tools with the dichotomous options. Closed-ended questions with the multiple options also we can give. Here the responder can tick either A, B, C, or D. You can see the question is, what is the major consequence of tobacco use? He can tick either A, B, C, or D. That is the instruction we would already given, so that to know, whether the person has the knowledge about the tobacco use and its effects. So that is my research question I want to answer. So basically they will respond it by, the more the option they tick, the better it is for me. That means they are very knowledgeable about this topic. So multiple options are suggested. One or multiple answers are the advantage is larger choice of answer options, and may be difficult to choose only one option. It's one of the disadvantages of these multiple options. They might be confused whether should I choose all options or one or two options. If you give a proper instructions, it becomes easier again. Closed-ended questions with a quantitative answers. The respondent must provide a quantified answer. Now, people always ask me, can I design a questionnaire where I can quantify my answer? The answer to that question is yes. You can use a Likert type of an questionnaire scale. You can use either a 5-point Likert scale, 3-point Likert scale, or a 7-point, as the example suggests here. It's a 10-point Likert scale, where what is your opinion about the statement of tobacco causes ill effects? People can choose from 0 to 10 as an option for their answers, so that we can quantify their answer, we can analyze. So semi-open questions can also be designed. You can see here I have designed a semi-open question here. Did your patient have complications following intraolvular extraction? That is basically impactions. So pain, swelling, and trismus, these are the three things which we usually expect. So I have given a last one is, if any others, specify. So it gives me other complications what the patients have gone through after intraolvular extraction. So it will add to the knowledge pool what is already there. So this is an example of a semi-open question. The advantage is leaves the door open to unplanned answers, and disadvantage is, again, whenever you have an open-ended question, you have to go through an elaborate process, so it is difficult to analyze. So we have come across three different types of questionnaire. That is the open-ended question, closed-ended question, semi-open question. So you can choose based on your aim and objective, research question, research hypothesis. You can mix and match. You can only have a closed-ended options. It's left to you. So what are the points which you have to take care when you're formulating the questions? Write short and precise questions, full and complete phrases, avoid ambiguities, do not use and or sentences because it will be difficult to analyze. Use simple words, everyday language. Now you can see here, avoid the double negatives and avoid negatives and double negatives. You can see the question here. Do you sometimes care for patients without washing hands? That's a sometimes, you don't know how many times. Does it do for every patient or a misses? So what would be the best way to phrase this question? Do you systematically wash hands before caring for each patient? You can devise this question 10 different ways, but this is one of the ways you can devise, and you can get a proper answer to that question. So the next part, what you have to do, what you have to keep in mind when you're formulating questions is ask only one question at a time. Did you refuse treatment because you have a fear of pain? You don't know why did he refuse the treatment. There might be many other reasons. So what you have to ask is, did you refuse treatment? If yes, was this because you have fear of pain? So you will get a specific answer. He refused treatment only because he had a fear of pain. So you know why he has refused, because of the pain. The next question is, are you aware of the modes of transmission of HIV? Among these practices, can you tell me those could expose to HIV? That is the best way of answering. It comes to my study, what I did for the first question. It was a scheduled interview. I have to narrate this story. I knew what was the mode of transmission for that patient. It was a scheduled interview, so we had an already I knew how did they got AIDS. But when I went into them and asked the question, they gave a varied number of answers. How did they got HIV? They did not give a right answer. This is how it is. So basically, formulate your question, be specific when you're formulating a question. Do not worry. The next point, the next answer is, use the neutral tone to avoid influence. Now, how have you been promiscuous in the last 6 months? Do not worry. Do not use such sentences. You can directly ask, how many partners have you had in the last 6 months? This is the best way to ask the question, so that it becomes easier for them to understand and answer to your questions. Sorting the order of the questions, you can go from, I've already told you, the order of the question makes a lot of difference. So you can go from the simple to complicated, from general to specific, from casual to intimate questions, from group together all the questions which are related to the same topic. You would be doing a research. Do not scatter them around, because it becomes faster for them to answer if it is all of them have answered together. Identification of the questions at the beginning and the end. Chronological order if the questions are related to the sequence of the events. And introduce simple questions as a break if the questionnaire is complex. I had my questionnaire of my first short term, which had around 40 questions. Because it was a scheduled interview, I could get answers for all the questions. But one thing I learned was, scheduled interview can go up to 4 hours to 5 hours per patients. That is what what happens. So if you are having 40 or 50 questions, please introduce with the simple questions, so that it doesn't become monotonous. When you finalize the data collection tool, you have to keep these 3 things in mind. Checking the instrument against your objective and analysis plan. Suppress, again, unnecessary question. Do not add unnecessary question. You can just check it. Add the missing question. If you feel that this has to be added, please add before giving it. Reviewing the instrument with the colleagues, with the experts, definitely with the statisticians for the coding part. What Ismail sir mentioned about the coding 0, 1, 2, and 3 makes a lot of difference. Dr. Lakshminarayan Sonde, who's presenting the next, he'll tell you the importance of this coding. This will become very important for you. Even the field workers, inform them, because they cannot put 0 instead of 1. You have to train them. Data entry operators, after collection of the data, please instruct the data entry operator also 0 and 1. If they enter the data wrongly, all the effort what you have taken will become nil. So language of the instrument, if you're if you have done the questionnaire in English, and if you want to convert into Hindi, English, Hindi, Kannada or Malayalam, in this case I have given an example of Hindi. You have to translate to Hindi and then back translate to English again to know the test and retest validity of the questionnaire. So basically, this is the process which can be done by a bilingual expert who's expert both in English and a Hindi. So before finalizing the data collection tool, these are the few items which you have to take into consideration. Yeah, the most important point of a pilot testing. Why do you have to do a pilot testing? The purpose of pre-testing or pilot testing of a questionnaire is whether the wordings of the questions are worded as will achieve the desired results. Very important. As I told you earlier, I would have designed so many questionnaire, and when you design a questionnaire, you will feel that I have done the best work. Until unless you give it to somebody else and the third person, and you finally give it to the person, you will come to know that they have so much of problem with each and every word you have put in that question. It can happen. It has happened to me. I'm telling so it's better you pilot test your questionnaire. There is nothing wrong into going back to the drawing board and rephrasing the questions. Okay, again and again I'll reiterate this point. When you're going ahead with the questionnaire study design, you give it to 2 or 3 people, check for the things, redo it. There is nothing wrong in it. Whether the questions have been placed in the best order, you will come to know. Whether questions are understood by all classes of the respondents. You know that illiterates, literates, you might have designed a question which can be answered by anybody and everybody. So you should know that whether they can respond to these type of a questionnaire. Whether additional or specifying questions are needed, or whether some questions should be eliminated. When you do the pilot testing, you will come to know that you just have to go junk all the questions what you have made and go back to the drawing board, or you need to do small tweaking. That you will come to know by doing a pilot testing. Whether instructions to the interviewers are adequate, probably the that also you will come to know whether the instructions have been given properly to them or not. So now the question is, how do you do this pilot testing? It's very simple. If your sample size is around 30, administer to the same population. Like if you want to collect the opinion about online education in the students of Enopoya, call the 10 students and give them the questionnaire and ask them to respond. And give a break of 1 day, and again you give them, and again you ask them to respond. Then you can do numerical statistical testing to understand whether your questionnaire is really measuring what you're trying to measure. So we call it as a test retest. There are many statistical tools, and I'm not going into the specifics of those here, because that can be dealt with in a separate session. So pilot testing is very important when you're designing a questionnaire. To summarize on data collection tools, decide on how to measure the concept. Now, if I want to measure the concept of how my students are like my online teaching, so that is my measure. Online teaching is my measure of the concept. So relate the concept to the study design and objective. I want to administer a question, so I will frame a question based on all those parameters. I'll ask them the question, did you like my way of presenting? So I can ask any type of a question. Did you like the slides? Did you like the content? I can put any type of a question, and I can administer to them. But again, it will based on my research objective and research question. If my research objective was on content, what the content I presented, so basically questions will be based on only on the contents, not on the slide designs, not on the slide preparation. No, it's only on the content it will focus on. So that is what you mean by concept. Match the scale and measure chosen to analysis plan. You can use a Likert scale. You can use an S or no option. I like, I don't like as an option. Definitely, it is based on your objective. Ensure reliability and validity. I'll come back to it in the further slides. Tailor the measures to study the participants, and decide how best to ask the actual questions. Now, this is whether you want to do interview, whether you want to do give them through mail, or you want to send them a postal questionnaire. You should go back and do the research. What is the response rate based on all these techniques. I would always choose a self-administered questionnaire or an interview type of a questionnaire, that is a scheduled interview, because I know that each and every person I will go, I'll make sure that I will get a response. So it's up to you to decide. Do not worry about what is the response. There are different ways of negating that. Our statisticians will help you to do it, but decide on how do you want to administer the questionnaire. Okay, so that comes to the end of my topic on data collection tools. Yeah, I have a question here. It's a simple drag and drop format. I think all of you are bored by now by the questions, The question is, uh, what do you mean by an open-ended question? I think you can see the question. I'm waiting for the responses. I can see all of my respondents, I think, are sleeping. Please use your mobile phones. Yes. I know technology is a little difficult for you to understand. I can see three of you have already got the knack of how to answer this. Okay, I think, okay, now it is four. This is how, we try to assimilate that how many of them are trying to understand this question. Okay, good. Close-ended questions means the respondent must provide a quantified answer. Okay, all of them are agreeing. I cannot believe. Probably you do not want me to continue. I thought all of you will disagree with me. Good. Best. I will not take much time. I think I'll wind up in another 10 minutes. I'll do it faster. What principles you have to take care when you're doing the data collection, which is very important. This will make life easier for you. What you have to do is data quality, what is reliability and accuracy. Simplest way of understanding reliability is if I devise a questionnaire on how well the online teaching is, and I've administered it to one person, and at the first point he'll answer that it was very good, and I administered to him the second time after 24 hours, and he tells maybe it was good, maybe it was good. Either my question, the way I have asked, is wrong, or the person who's responded is biased, or altogether that the entire questionnaire is wrong. So there are various statistical measures by which we can measure the reliability of a questionnaire. Cronbach's alpha is one thing. So once you design a questionnaire, we'll come to it. So it is basically the ability of a measurement tool or a questionnaire tool to measure reliably. Every time you give this questionnaire, it should be able to get the same response from the same respondent, or it should be able to measure the same way it is measuring. So if it is not able to measure, either you have to rephrase the sentences, or you have to administer again and again and to find out whether the question is good. So you can go back to the drawing board and rephrase the sentence. This is what is exactly mean by reliability. The accuracy is ability of a measurement to be correct on an average. Again, it's a statistical concept. So I have here archery tool, which is most of the time majority of them used to explain this concept of reliability, validity, and accuracy, these three important words. So you can see here in example one, all the arrows have gone and hit the bullseye. So it is both accurate and precise. Your questionnaire, when you administer, it should be like this. You should get the same answers at the end of the day by all the respondents. Now you can see here it is accurate, but it is not precise. It is clustered around in and around your bullseye, but it is maybe accurate, you can say, but it is not yet precise. The third example what is there is it is precise. It has hit all the outside arrows, but it is not accurate. The idea was to hit the bullseye, isn't it? The idea is to hit the bullseye, but he's, for various reasons, he's able to hit consistently at one point in time. Maybe his technique is wrong, or his position of the arrow is wrong, because he's getting, at the end of the day, he's precise. He's able to hit that point again and again. Now it is for his trainer to decide why he's going wrong. And the next example is, he's everywhere. He might be a beginner who's trying to learn archery skills, so he's everywhere. Okay, now I can tell you a concept of very simple about validity as well. So think about this as an example, and you can see here it is arrow. Now I have a participant 2. This is a participant 1 who's hit the bullseye, and it's correctly hitting the center. So he's very all the results what you get, it's a valid. Now my participant 2 will come. He's like, he gets an axe. He does not get an arrow, but he'll get an axe and he'll hit the axe. And at every time he throw the axe, he is hit the bullseye. Is it a valid, no, it's not valid, because what is the point here? He has to be an archer. I'm not testing his, axe throwing skills here. Main point is he is supposed to do the archery skill. So ultimately, to understand the concept of validity, I have put here. I have given one more example to understand, to make all of you know very easy. There are 3 characters here who will guide us to understand the concept of validity here. You know all these characters really well. The first one is the Mr. Virus, who is Mr. Know-It-All. The second part is Mr. Funsuk Wangdu, who is the Mr. Analyzer. The third part is the Mr. Chatur, who is Mr. Definition. Now you can see here, sir, will I top this exam? That's what is the Mr. Chatur is asking. As usual, Mr. Virus is answering like, I did not have favorite students. It's not easy to top the exams. I was the topper of my batch. That's what Mr. Virus is answering. We have a Mr. Analyzer who will tell, excuse me, sir, you are not giving the valid answers. So we have a Mr. Chatur who says, validity is the ability of an instrument to measure what is intended to measure. I gave you already an example of an arrow and an axe throwing. You can just relate these abstract concepts to understand the concept of validity. Validity is, if you're asking a question, it should be able to measure what you're trying to answer, what you are trying to get the response from the uh, participants. I hope you all have understood these simple concepts, that is reliability, validity, and accuracy. Let me tell what are the 6 steps you have to follow to make the data collection proper. Draft question by question guide. Train the staff members who will collect the data. Initiate the data collection and ensure quality. Review the collected data for quality and completeness. Debrief to troubleshoot the difficulties and validate. What are these? We'll go step by step. Draft question, question by question. Let me give an example here. You can see here question by question guide means my question number 6 says housing. Whether the house is made up of mud or bricks, I should tell them beforehand. When they are made up of mud, they just have to tick the mud as an option. Now questionnaire number 12 says household income. So you can see that there are 10 members in a family and 5 of them are earning. So the household income will be addition of all those 5 people, not the head of the family only. Usually we think about, father who's the head of the family, his own income has to be taken into consideration. No, all the other 5 who are, all the other 4 who are introducing, who are, earning, which should be included in the household income. So these information you should give it prior to all the respondents. If you are administering by yourself, you also should know. Train the staff who will collect the data. Now I'm not expecting, most of the postgraduates will go on their own. If you have a researcher who will be doing the research for you as a research assistant, you train him very well in advance. Select good and experienced investigator. You make the presentation to him, both your study and your objectives, preferably in the form of a slide presentation, because he has to understand your study, because he is collecting the data for you. If you do not do this, he will just go administer, collect some data and come. At the end of the day, when you analyze, you will feel, oh, okay, my study is not good. I have done this wrong. This is what you mean by question guide to the, the person who is doing the study. Again, walk through the question by question, list all the tasks to be conducted by that person, make him answer that question, simulate the interview. If he's doing interview for you, simulate the interview. You can be a responder, he can ask the question, so that you know where he's doing the mistake, so that you can correct him before he goes to the field. Initiate the data collection and ensure quality, very important. Do pilot on site interviews under supervision. Definitely you can do this. As I told you earlier, if I'm doing on students about online teaching, what would I do is I will call the students, and if I have somebody else collecting the data, I will ask him to collect the data for me, and I will observe him how he is collecting the data, whether he's collecting rightly or wrongly. If he's doing anything in the mistake, I would not tell him at that point in time. I will allow him to complete the entire collection of the data, and then I will discuss with him where he has gone wrong, how he has to do it. And plan the data collection process with the supervisor as well as the investigators. If you have a doubt, you can always go back and ask the questions, so that the data collected is precise and it has a quality. Review the collected data for quality and the completeness. This is, at the end of the day, it's the duty. If you are a postgraduate student or if you are a researcher, you have to make sure that what questionnaire comes to it, it might be 100 forms, it might be 200 forms. You can assign this job to somebody else, or you can do it on your own. Because after completion of thousands of forms, you come to know that one particular question, which is a very important question to your study, is being administered wrongly. Then your entire study is gone. So you have to do this job. I know it's very difficult, but you have to do it. There is no other go about it. checks to be conducted are for the completeness of the data. If what happens is, I have been myself, Dr. Lakshmi Narayan Sonde can vouch for it. We have gone for an oral health survey during our postgraduate time, and we had to collect around 100 to 200 people's data. So because we had to collect, pressure was there to 100 to 200 data. When we used to collect the forms, we used to think that there are some positive points, like when there are negative points where you have to just fill up zeros. We thought, after collecting 100 people, we'll fill up those zeros. Trust me, when I went and submitted on day one to my HOD, I had been called to her chamber 100 times. I did not know my HOD will check it 100 times. No, that WHO proforma had thousands of zeros to be put in. Invariably we had missed in one or the other places. So I had to go 100 times. That is the first time I realized what is the importance of completeness of the collection of the data. Okay, readability, it's about writing readable. Consistency, do the answers make sense? Is there an internal consistency? If any things are there, you can always change the questionnaire. Debrief, to troubleshoot difficulties. Regular meetings with evening or morning you can do. You can facilitate a discussion about issues identified by them and clarification if they require. Make a note of the decisions on question by question if needed. You have to do this debriefing session if it is a large scale study. Even if it is a small scale study, you have to do it if somebody else is collecting the data. It will help you improve the quality of your data. It will help you to improve your complete question forms. You can always change the question. Do inform your ethical committee about the changes what you make. That is a small highlight I would like to give you. And validate, definitely select a number of study participants at random, conduct a second interview, compare the results, debrief discrepancies with the individual workers if the errors are made by a particular investigator, whole team if the issue is relevant for all. So these are the small pointers which you have to make sure that to collect and ensure that data what you have collected has a quality and it is very good. At the end of the day, the take-home message would be understand the concepts of data quality. It's very important. You might think that it's not relevant, but at the end of the day, when you analyze, you will feel, oh, I should have done that. Oh, I should have done this. So all the steps what I've mentioned earlier will help you to collect a quality data. Good training offsite and onsite is also essential. I have enough and more experience on this. If you give it to somebody else to collect the data, what happens. They might not put all the efforts what you have put in. So being there, asking them every time, did you collect this question? Small tips here and there will help him. He will come to know, okay, he is watching me, he is seeing me. So that will help you. This is about on-site, which is essential. Supportive supervision. Sometimes if some of the data is missing, which which usually happens, they will think that we'll fill it later. Do not be overdo things. Make sure that make it a little bit easier on them, so that it becomes they enjoy your work. At the end of the day, it's a teamwork. It's not that one person who can do it. It's a teamwork which is essential to have a good quality data collection. Now, even I still remember I had done my second study. I had my postgraduate student who, with a two-wheeler, we had gone to almost 300 to 400 dental clinics in the Bangalore. I think I conducted this study for 30 days with him. So this is a simple example how teamwork, because I did not know to ride a two-wheeler in Bangalore. Thankful to him that I can still be thankful to him that he came along with me so many days. That's how teamwork can help you to complete your study as well. Thank you one and all. These are my references. I stuck to ICMR presentation because one problem I have is to concise my presentation. So I stuck to ICMR presentation to make the study, and also my ML web sessions at FEMA Fellowship to this presentation. Thank you one and all.
Thank you, sir, for the informative session. Now the session is open for discussion.
Thank you, Imran. Am I audible?
Yes, sir. Yes, sir.
Yes. Any questions from the PGs?
I think I have two people who have responded, sir. We can see. Okay.
Okay.
I had put it purposefully, this question. Did you understand? I am a little confused. stop, I need help. I know that nobody wants to put stop, I need help because they want me to end my presentation here.
Yeah.
But I still
The
wanted to
subject
see.
also. Yeah. The subject
Yes,
also. What
yes.
speed it goes inside, same speed it comes out. Also, it will take some days to
Yes,
understand
sir.
also, and the guidance also.
Yes, sir. Yes, sir. Correct, sir. Exactly what you mentioned is correct because when I started my post graduation in public health dentistry, I still remember on questionnaire. Thankfully, I should thank my statistician, Dr. Suresh, who made me understand sample size collection doesn't mean that you take your key article and tell him, sir, calculate sample size. I still remember he made me sit in one corner, and I went him at 10 o'clock in the morning. He calculated my sample size at 5 o'clock in the evening. So he made me read the article from morning till evening. Then I realized what exactly is sample size calculation. So some of my life
Uh,
experiences which made me go into the statistics world. Yes, sir.
I
Go
have
ahead.
one question, Imran. Is there any differences between the data collection and validation when it comes to a questionnaire study and the clinical studies? Because yes, now we are in a COVID situation, we'll be more towards a questionnaire-based studies. But most of the PGs are there in the clinical department. Is there any? What is your comment on that aspect?
Uh, the answer to that question is the answer is yes. You can do n number of studies with the questionnaire. You can beautifully design questionnaire. You can even copyright that questionnaire. I'm telling you, copywriting is not difficult. It just takes 500 rupees. I'll come back to the second part of your answers, but let me come to the interesting part of you. Now, how would you like your questionnaire to be copyrighted and telling that these are the questions I have designed? Now, that will be out of the world feeling. And earn from that questionnaire. You can tell that you have to pay me 10 rupees if you want to answer this, if you want to administer this questionnaire. It's a relevant questionnaire which will address a very important aspect of the study of interest. It can be on dental caries, it can be on periodontal disease, it can be on oral cancer. Now, if I come back to it, if it answers on a question on oral health related quality of life, let me tell you on oral health related quality of life, you have designed a 5-point question which will measure the oral health related quality of life, maybe after cancer surgeries, maybe after dental treatment, maybe after periodontal surgery. But it measures their oral hygiene. And mind you, I have put it as 5 questions, and that 5 questions will tell you how well. So there will be thousands of people who will line up for you to buy that question from you to administer to all the people and get the response from you. The question to the answer is if whether it is a clinical, whether it is an observation, whether it's a cross section, definitely you can design a good questionnaire. What you have to do is fix up a research question, research hypothesis. That research question is a key to designing your questionnaire. Now, if I tell oral health related quality of life after simple class 1 amalgam restoration, what happens? We all know that we have learned. I have done my class on restoration. If I remember correctly, that the patient was next day was there in the operatory room. I just ran from my department. I did not want him to tell. I thought that the restoration had come out, but he had a simple high point. So his quality of life, basically after restoration, we tend to think that his quality of life of achieving should improve because I had left an high point. He was not able to chew from that side. Next day he was there on the operatory, with the pain. So this is a simple example. I can put that big question. The answer to that question is the yes. I hope I've answered to your question, sir.
I don't think so. Any questions from the postgraduate side also, Imran? Uh,
Yes, sir. I
so
think
I think we will end the session here. Thank you very much
yeah.
for this wonderful session of data and validation and reliability. Thank you
Thank
very
you,
much.
sir. Thank you, sir.
Thank you, sir.
So let's start the third session, Overview of Data Management and Analysis by Dr. Lakshmi Narayan Sonde, Reader, Department of Public Health Dentistry, member of YEC1, member of CHPE and Yen-DEU. Today's moderator for the third session is Dr. Imad Mohammad Ismail, Associate Professor, Department of Community Medicine, Yenapoya Medical College. Let's start the third session. Dr. Lakshmi Narayan Sonde, Over to you, sir.
Yeah, I was more bored.